Hello, everybody. First of all, I would like to thank you, Kuraray Noritake, for the invitation on this amazing event. It's really an honor for me to be between this amazing speakers lineup, and how in our country we say that it's so difficult to singing after Pavarotti. I think now I am singing after many of Pavarottis here. The topic of my presentation, it's Mind the Gap. It's Mind the Gap series about things which influencing the gap between preparation and restoration. And I will speaking about the main things. One is the marginal gap of the millet or printer restoration, and second thing is dynamical stability of zirconia oxide frameworks. Exist a lot of factors which influencing marginal gap. Especially in our country, usually the dentist thinking about the best devices, more accurate scanner, printer, the milling unit, and they are like focusing for the microns of precision. But I have recognized that the most important part in a dentistry is what we are doing, like humans, like a dentist, dental technicians, because we are under different conditions. Sometimes we have the like good conditions, sometimes bad. We have the better mood, we have less. Sometimes we have the handshaking. And once we will start to work, once we will start to do, for example, the crowns, veneers, many times it started with soft tissue management. My recommendation for all the digital world now is to use the contrast cord, like this one is a black cord, non-impregnate, not medicated. And this is a very thin 3-0 cord, because this one has the best contrast after that between the hard tissue, between the soft tissue, and it's better visible the margin. And when we start to speak about the preparation, very important part is which kind of the burr we are using, because exist many of the on the market, and especially the three, this fine, medium, and coarse are the most used between the dentist. Of course, exists the black one, but it's an enamel color, and I highly recommend you don't use this one. Because we are doing a lot of trainings in our academy, and we are making like our internal statistics, which kind of the burr usually the dentist using for the preparation, like in the beginning in the enamel. And majority use this, the middle one, 48%, then the green strip, and the only 10-11% they use the red strip instrument. And what we have to know is that the green coarse instrument has the particles, the nymos particles, 150 microns average. And as you know, the recommendation from FDA or American Dental Association or Prosthetic Academy is that the gap between the restoration and the tooth preparation during the dry fitting is like between 20 to 120 microns. Once we will use the diamond coated instrument with 150 microns, we are over this the gap recommendation. And this is how to look the tooth surface after. You can see how many chippings, invisible cracks inside. And after that, it's very difficult evaluated devices, very difficult evaluated materials, because the milling units or printers, they give us really excellent results in this time. And there is a real problem once we will prep the enamel surface, especially if we are prepping around the neck, where is a lot of aprismatic enamel. Even worse, a lot of chippings there is because the enamel is not so strong, like, for example, in the sisal edge. This is how to look preparation with the medium coarse instrument, where is 100 microns, the average, the size of the particles. And this is how to look the tooth surface with the SI microscope. You can see the chippings are less, but are visible internal cracks, which are totally invisible with the human eyes. And there, I think it's a part of the things which can be responsible for post-operative sensitivity. If we are not well, like the bonding surface, if we are not using, for example, dentin sealing once happened, the things that the dentin exposure, these cracks can be responsible for post-operative sensitivity. And this is how to look the instrument, the red fine instrument with 46 the microns particle size, and this is how to look the marginal edge. You can see the huge difference which can be influenced like a dentist. A lot of dentists, for example, starting with the green strip instrument and then try to smooth with the red one, but maybe we will remove the incisal chipping, the marginal chipping, sorry, but we can seal these internal cracks inside. Other things which influence the gap and precision of our restoration is the margination. That means the placement of the margin line. Many times the software to do that alone for us, like with the automatic magnetic tools. And what is important to know that it's coming from occlusal view. That means it's not exactly on the margin, it's a little bit like on the top of the margin. That's why we have to check many times with different angle of the tooth and control how the margin is seated. Because, for example, like in this case, if it's a little bit inside the preparation, then it can happen also that our restoration it's not fit on the margin of our preparation. And this is why I highly recommend you all to dentists to place the margin line alone, because especially again in our area where I live, a lot of dentists delegate a scan to dental technician without the marginal placement. And I think this is what I recommend to dentists, because we know better the preparation than our dental technicians, because they have no idea once they look the case where sometimes we are a lot subgingivally because the previous damage, the previous preparation or old, the amalgam fillings. That's why it's important to be placed by a dentist. Depends on the scanner, and the software of the scanner exists in a software which we are using for scanning and analyzing tools. And this is why, again, I highly recommend the dentist to use the tools, because they are the best teacher ever. For example, distance antagonist. It's very difficult to see how is prepped the palatal surface if we are asking the patient to bite, or lingual cuspids of the posterior aspect in the lower jaw. To control the lingual cuspids is almost impossible, because when the patient bite, we will see only the vestibular cuspids, and we can see through the cuspids how well prepped and how is the clearance in the lingual cuspids. Undercuts. Yeah, thanks to God, we are living in a minimum invasive era. We are like skipping this sombrero preparation, which will be connected together with endodontic treatment immediately, because for us, that time, the pulp looks like appendix. As soon as possible will be removed, it will save our life. Now we are in a minimum invasive age, because minimum invasive, that means maximum adhesive. Once we will staying in a preparation like 0.3, 0.2, and we have the undercuts like here, 0.1 or 0.15, the system will influence the thickness of our restoration, because it will reduce and block these undercuts. And in a final situation after milling, the restoration has not thickness 0.3, but for example 0.15. Depends on which milling unit you will use. That's true that the chairside milling unit is a little bit more aggressive. That means the algorithm of the milling is not so soft like lab 5-axis milling unit. This kind of reduction and the blocking the undercuts can be responsible for the cracking the restoration during the milling process, or sometimes later during the dry drying. But the problem is that it's invisible. If we are not going through these undercuts detection, after that it's really difficult to see the problem with the blocking the undercuts later. Another option is the checking how smooth is the margin, because here we have this warning, this orange warning that something is wrong in our preparation and the milling unit is not able to mill. And you can see how it looks in reality if we don't care about this chipping which can happen during the milling, because then, for example, the restoration can fit really great, but our preparation is not fit good because of the chipping which has happened during the preparation. And the smoothing the sharp edges. It's another advantage to remove all the things, because the algorithm of the milling units is responsible for the thickness of these finest instruments going internally to the surface of the restoration. For example, if our edge is 0.1 or 0.2, it always will be over-milled and then can destroy as well the restoration, not only like the strongness, but also aesthetic aspects, because when the restoration has a different thickness, especially in vestibular part of the tooth, can happen the problem with the spots which will do discoloration of the vestibular surface. I have already spoken about this. Our recommendation, this clinically acceptable range is between 20 to 120. We need a space for removing our debonding and eluting agents going after restoration. That's why it's starting for 20, but 120 is recommended the maximum of drying of the restoration. And this range is exactly the thickness of the human hair. This is how stressful the dentistry is, because we are balancing on this super precise the thickness. True is that, for example, the African people has the thicker hair than the Scandinavian Norwegian have the thinner hair, but still we are in this thickness. I would like to share with you the few slides of one of my research when we're comparing two different the chairside milling units and also the results which appear after different restorations. We have starting with the sample of the prep tooth with the red instrument, and then try and measure on 8 parts of the tooth to gap between the restoration. We use different teeth preparation, we use different material, different measurement, and this is like roughly how they look. For example, the CEREC block. The CEREC block is feldspathic material, and when we prepared our tooth, then the range of like the gap was between 23 to 51 microns, and that means was acceptable according recommendation by American Dental Association. Look at lithium disilicate. Lithium disilicate was the worst material which appeared in our study. Because of the strongness of the material. Each sample has this chipping on the surface. It doesn't matter which milling unit we used, always we found the big chipping around the margin. The gap was acceptable, but problem is how strong material is, and definitely this material is the worst and all disilicates for the milling. When we are doing lithium disilicate like the press technique, it's a completely different story. But for the milling, especially the chairside milling, it's really not so good. And you can see here zirconia manufactured by Kuraray Noritake. It's a brand name Katana, 19 to 21 microns. It's really great results. We can be more precise because we are on this border 20 microns recommendation. And it's happened thanks to like ability material for the milling, and also because everything is milled like 1/3 or 30%, almost 30% bigger. That's when we will use the same instruments, that's why the older surface has more details, more beautiful, has a higher anatomy, and also avoiding the chipping around the margin. All that's the information you can find in already the published study in the Journal of Computerized Dentistry, and you can find there more about the different kind of the material results. And because appear on the market the new materials, and especially like 3D printed materials, we also like evaluated this new material, for example, with the PMMA discs, which we are using for a temporary restoration. For example, with the permanent crown resin, Vario Smile has the maximum gap 39%, but we receive like very bad results with temporary printed material, especially if we are using like not well improved the curing machines, because that one is for that one was the used recommended the curing machine by Formlabs, and we sent the data to this company about this problem that the curing clamp is not fit well for the temporary resins because they are not high filled, and that's why the shrinkage it's bigger than the permanent material, but they don't care. I asked them if I can publish with the audiences, with other colleagues. They told me, okay, so we are not responsible because it's not their material, but they are responsible because it's curing clamp the problem. And here you can see the very precise the composite material, also manufactured by Kuraray Noritake with the name the Katana Avencia. And because really I more and more love this the composite material, I would like to share with you also the case where we made non-prep veneer to this very young lady. We have already spoken here with the different speakers about diastema, about is a beauty or not. This lady is suffering psychically because of diastema, and she really needs this treatment. That's why we decided as well, we've spoken with her that, for example, Madonna is a sex symbol, has the gap between the teeth, that she don't care. But, you know, sometimes the people has a different perspective, look to the aesthetic results and what aesthetic shapes looks. That's why we decided to help her, and we apply non-prep veneer from this case. Her teeth was really beautiful, has a beautiful ledges, anatomy, and we try to copy the surface of the teeth and only to stretch and to make a little bit wider the veneers in the results. This is only what we made, the retraction cord for scanning, and here you can see we scan initial like non-prep teeth and just to make them wider and save all these ledges, all these anatomical beauties, all these like perfect imperfections which the people have on anterior teeth. We used especially for midline, the face scan, and we like apply the face scan to the software. Here you can see the design and how we manage one of the most important line. This is the midline, like perpendicular line between bipupillar line and the midline going through central incisors. And here's the workflow as well with the articulator, because one thing is that we can do additive treatment. We try to make teeth a little bit longer because the part of incisors was a little bit abraded. But once we will make a teeth longer, we have to evaluate it with the all anterior guidance and the canine guidance if we really can manufacture a little bit longer teeth and avoid any potential cracks or like debonding which can happen during the functional movement. You know that exists two types of the mock-up. We prefer, especially for non-prep cases, the mock-up veneers. They are milled from PMMA, and here you can see dry try-in of this mock-up on a tooth, and this is how they look like the temporary bonding, and in reality the close-up picture of the mock-up in the mouth. I am not a guy who would like to do everything in like single day or 2 days treatment. I really appreciate if we have a time for the functional and also the family evaluation of our restoration with the patient, because you know, sometimes we are satisfied, the patients are satisfied, but for example, the boyfriend or the husband or someone could start to laughing that they looks like the rabbits and these are too long, and especially the people, if they are like suffering with diastema between the teeth, they are very easy to be manipulated with another person, that what is looks good and what not. That's why we prefer this like the functional and also like the family evaluation of the shape of the function as well. Here's a difference between like before and with the mock-up. And once the patient is satisfied, we are just going to the software. When we have to adjust, yeah, we adjust. If not, we are going and changing only the material. My recommendation is also, because the default of setting of the many the CAM software is the placement of the sprue from the vestibule part of the thinnest part of the restoration. That's my recommendation, is place the sprue of the thickest part, and this is incisal edge, because if it will be like a default setting can happen the cracks during the milling, especially if we are like have the non-prep case with a thickness 0.1, 0.2 millimeters. But in this case, we made experiments, because really I try to make a research how strongness and how high flexibility the Avencia has, and we leave the sprue how was default recommendation by the software, and you can see all the restorations that fit well, and also how beautiful the margin without the chipping is there. And yeah, this is how we prepare the bonding. We're using for the bonding preheated composite, 68 degrees Celsius preheated, because this is like temperature, crucial temperature when it's well seated or it's unseated, because if cooling, dramatically going down, cooling the material. And this here, you can see the protocol. Yeah, we are using here the rubber dam. You have already heard here during the audience that it's how important rubber dam is or not, but for me the more importance of the rubber dam is that we can easy to clean rest of material, bonding material around the tooth, because this is how happen the problems. It's not about this white aesthetic, it's also about the pink aesthetic. And if we will leave the small part of the bonding material in a sulcus, immediately starting inflammation. One dentist try to remove it with the scaler, with another instruments, start bleeding. It can destroy all our effort before, from dental technician and from design, all of them. And if you will find it later during the recall process, you can see how difficult it is to remove again, because it's enough the single touch of this inflammation and bleeding appear everywhere in the sulcus. And this is what I'm talking. You can see here the situation with the rubber dam and without rubber dam. It's about the beauty and healthy the soft tissue. Here's a close-up picture. Again, before, after the video of the lady. And because we are dentists and we are highly addicted to details, you can see here the close-up, the video before and after. And because the Avencia is monocolor block of the composite, but still we can very easy to manage the mamelons and transparency. And the trick is that we are doing reduction from the palatal surface. There is not like cutback, there is not layering, because we will damage with the layering the copy of the beautiful teeth morphology. We are making palatal reduction and filling this reduction just with a transparent composite, because the composite is almost the same, and this is how we're managing this transparency in this case. Yeah, little break, because once you will start to focus for the micro pictures, you can sometimes find animals, beautiful animals. I don't know if you haven't been bitten by a flea, but sometimes the flea has a problem with the teeth as well, because you can see a big crack of caninus, and I don't know how deep the flea is suffering because of that. Okay, the second part of my lecture is about this dimensional stability. We are comparing different zirconia, and also at the beginning, because once we started talking about stability of zirconia after sintering and how precise the material really is, we try to find also discover and evaluating the scanners. And we already published this evaluation where we measured trueness and precision, but especially trueness for us in this case when we prepared the sample in an all-on-4 model. The trueness was like the value which we needed exactly, the more than, for example, precision. This is how look about the model. We use always the metal scan bodies, because when we have the metal scan body, fitting metal scan body to the metal, for example, the abutment, doesn't matter which one, it's more exact connection and precise than we use, for example, the plastic single-use one, because especially in an area where I live, what is for another part of the Europe single-use, dentists in our country using many times, they don't care about the precision, because if you are not looking closely to the details, you can see the problems. And this is what we say, that if we are having no magnification, no microscopes, we sleeping definitely better. The study was prepared like the scanned model by extraoral scanner INOS X5. Why we decided to use this scanner? Because this scanner was the winner for long distance measurement, 8 centimeter pattern. That's why we decided this like sample for correlation, and we use the same intraoral scanner strategy, and we evaluating this colorimetric map by ExoCAD software. This is what's happened always. Extraoral scanner is better, has a more beautiful, nicer surface on a scan body and other part of the tooth than intraoral scanner. It doesn't matter which kind of the scanner. Almost all the scanners was the same, has a not beautiful sharp the edges on the scan body. But the developer of the software find a solution for that, because inside the software, thanks to catalogs of pre-scanned scan body, we can substitute exactly precise scan body inside the software. That's why the companies now allow us to use intraoral scanner also for frameworks like Edentalos cases scanned by intraoral scanner. This is how to look the models with abutments. Yeah, we adjusted the scan bodies, and yeah, this is what I want to talk. This is internal catalog of the scan bodies, which will be substituted to correlate as much as possible. The best substitution inside the software depends on how well scanned the scan body is. In reality, it looks like that, and as much as the red color is around, the blue color is around the scan body, this is the better matching. We preset this matching and also the measurement from 0 to 0.1. That means from the 0 to 100 microns. That means it's very high accuracy for the measurement. And we, you can see here, all this, the 5 scanners. yeah, there are few differences between them, but we have not sufficient time to speak about these details now. But here is how to look at the results of the colorimetric map. And like when we can say the winner was the iTero and the prime scan from these two, but all these 5 scanners was acceptable for this kind of treatment. And it's really difficult to say that, for example, the MEDIT we can use. It's not true because it's only about initial precision of colorimetric map setting inside the ExoCAD. And once we have exactly like in apostrophe the best scanner, then we decide to use to evaluate it these 3 materials. All the 3 materials are multi-yttria discs. And the first was like this Copra Supreme Hyperion from the White Peaks. They have 4 yttria layers. Second was this is zirconia from the Ivoclar, which has 2 yttria layer, and already named many times, celebrated YML Katana zirconia with 3 yttria layer. We use this sample and we designed the framework. Now, don't look please about the aesthetic of the frameworks, because we have to eliminate the contact with the soft tissue, because we measured like how exactly to fit each hole inside the framework to the other abutment. That means we have to avoid this, like eliminate the like pre-contact which can happen when we touched with the framework the soft tissue. That's why we don't care about design, about the connection with the soft tissue, only precision, and we measure a vertical and horizontal dimension of the changes. Here is how to look inside the framework inside the disk. We use this sintering supports, because without the sintering supports is really I have not the pictures here, but the results was really disastrous. That means we use always the same supports for all these 3 materials, and here is how it looks after milling, and this is what we evaluated: horizontal distortion, vertical distortion, and also the force of screwing abutments, because at the beginning all the frameworks, the fit to the abutments, but was really the big difference how much power we have to use to fit in all 4 the parts of the implants. Horizontal distortion measurement. We use electronic microscope. We measure at the beginning these A, B, C, D distances, and we screw it inside one-time abutment. On the anterior zone was this 4 millimeter and posterior 5.7 millimeters, and we like bond it into the restoration these tie bases with a free rotation, because they are designed for the work like this one. And you can see here the real measurement in the beginning on the model, and then with all 3 materials. Here is the White Peak, here is Ivoclar, and here is Katana frameworks. And here you can see a result in a horizontal distortion was minus 170 microns average in White Peak, plus 997. This is the biggest distortion which happened between like posterior to abutments, was plus almost 1,000 microns, and only 82 and 79 was in Katana zirconia YML. Then we measure vertical distortion. That means the gap between the framework and the abutment level. Here was the white peak. The A is always fit because it's possibly without distance. But look at the first, the B was 140, 313 microns in point C, and point D 805 microns. This is how look the Ivoclar. The maximum was the 782. And this is how look Katana YML. The maximum was 178 microns, that means 0.1 millimeter. Here is evaluation of two measurements because this kind of the measurement is very expensive because of the discs, because of the abutments which are like the bonded into the restoration, avoid all this discrepancy and to be as much as accurate. But you can see how big difference are between multi-yttria zirconia discs. And the more like important for us, like for clinicians, is the measuring the force which we needed for the screwing the frameworks. And because recommendation from the company from this kind of the screw inside the abutment is maximum 30 Newton centimeters, you can see like the biggest force is in Katana zirconia, a little bit over this 31 Newton centimeter, which we need for the fitting all this zirconia restoration on our sample model. Look at the Emax Zircat Prime. It's 42. It's between the part 1 and part 2. This is between the first and second abutment. And Supreme from White Peak, you can see that was more than 60 because the device for measurement was the maximum 60 Newton centimeters. That means we don't know how much was in reality, but was over double which power which we can use for this using the frameworks. This is really the huge problem because the old dentists try to fit the restoration because the zirconia individualized frameworks is very expensive with all this abutment luting inside. It's very expensive. Also for the patient, it's even more expensive. And when it's happened, the things that frameworks crack, okay, this is the big issue because we have to repeat it everything. But once the crack, the screw inside the abutment, even worse, because they remove the screw from the implants, this is real nightmare. That's why we measured that we should be like sure that what we are using in clinical practice to give us the opportunity to sleep better and to just like to pray that nothing happen, especially in the cases like this. The research which we are doing in our practice, it's not like motivated with the PhD or any other diploma. We're always focusing for the important parts which can be influenced like humans from the dentist side or from lab side. Here you can see results, and here's a summary of the factors which influencing, sure, the guided implantology will give us the great position of parallel implants as well. This is how we can influence all the things which all of six frameworks. You have already seen these differences between these two big zirconia powder the companies which production around the world, and we evaluated also in a study the surface. For example, in a molar part, in these 4 places, you can see how to look Tochos zirconia after milling with the fine milling in a primal milling unit. This is still chairside, like in-office milling unit, but with the finest possible to algorithm inside a milling unit. And you can see how is the difference with the same burrs, same algorithm, same milling unit with Noritake material. Yeah, it's visible on a first look. This is how it looks when we polish before the sintering, because it's good when we polish this soft stage the material, and how it looks again katana really better. And that's why we polish. Once it's glazed, it's invisible what is behind the surface. And you have already heard and seen amazing presentation from my colleagues here, how stable the glaze is on the surface. It's really totally unpredictable. And the last three pictures, you can see also the difference, like the magnification with SI microscope, how to look just only the material between White Peak zirconia, IMAX zirconia prime, and Katana zirconia YML. I will finish my presentation with another animal, with this beautiful, beautiful ant body. I don't know if you know that these animals living like a million years in front of us on the planet, they are still here with us, with a beautiful energy and power and community cooperation. But maybe you didn't know they have hairy eyes. And also maybe you don't know that we found, this is the hairs on the eyes, and maybe you don't know that they have on their body, and we find it on each samples, something like USB connection. Maybe that's why they have too much power. And I wish you really to have enough power, especially on the end of the day like this one. And I really thank you for all of you who stay here to the whole end of the day. Also, I have to thank you, translators, because you know sometimes how much boring it is for us to listen same things about this, but for them should be twice more difficult. Thank you for translation. Thank you for attention. Thank you.